This is the Metaneb device. This device provides intrapulmonary percussive ventilation. It is used in the hospital setting to help with airway clearance and lung expansion. The Metaneb has 3 modes. The first mode is continuous high frequency oscillation, also known as CHFO. The second mode is continuous positive expiratory pressure, also known as CPEP, and aerosol delivery.
So some indications for the Metaneb to mobilize secretions for lung expansion therapy. It's a treatment and prevention for atelectasis and to provide supplemental oxygen. A couple absolute contraindications is untreated tension pneumothorax or untrained, unskilled operator. And relative contraindications are history of pneumothoraxes, pulmonary air leak, recent pneumonectomy, pulmonary hemorrhage, myocardial infarction, and vomiting.
Hi, my name is Stephanie and I'm going to be talking about the settings on the Metaneb. So the Metaneb has 3 different settings. One is for lung expansion, which is CPEP, continuous positive expiratory pressure. Then we have secretion clearance setting, which is going to be CHFO, continuous high frequency oscillation. Then we have just aerosol. For the lung expansion therapy, the form is CPEP, which is continuous positive expiratory pressure. The types of patients and conditions you would use this mode for would be illnesses such as neuromuscular diseases, restrictive lung diseases such as COPD, patients with spinal injuries, or patients who have had upper abdominal or thoracic surgery. With CPEP, you use the flow, so you can increase or decrease the flow of the CPEP therapy you are trying to provide. Then we have the secretion clearance therapy, which is the continuous high frequency oscillation, and you would just turn the dial to have just that therapy be used. CHFO is effective in mobilizing secretions. It relaxes bronchial smooth muscles so that airway resistance is decreased, and when using the aerosol therapy combined with it, it also hydrates thickened retained secretions. The types of conditions and the types of patients you will use this type of therapy would be for patients that have cystic fibrosis, bronchiectasis, or pneumonia. Depending on the type of patient and illness you are working with, you can use both of the therapies on the patient. Each of the treatments can be given within 3 to 5 minutes. This is the dial that you would use to change from CPEP to CHFO or just aerosol therapy.
This is Helen. So today I'm going to set up the Metaneb for the spontaneous breath procedure. So this is the Metaneb system. It includes the control panel, stand, and the disposable circuit. So control panel is in the middle is the pressure manometer, and this is the model select switch. In the middle is aerosol only, and the left side is a CPAP. CPAP is just for the lung expansion mode. It's going to make a nice, slow, and fast deep breath. In the right side is CHFO mode. So this make the higher and the lower frequency of the oscillator. So the gas connector is fixed this device. Oxygen connector, one side is touched this Metaneb, otherwise it's fully sealed, and another side is connects the wall outlet with 50 psi. Is the disposable circuit kit So I pull out from the package. So here is nebulizer. We open it, and the saline is 0.9% as saline today. Normally we put the medicine in it. And close the cap tightly, and it connects with the handset. The nebulizer pattern, we have a 3 option choice. So we have a 1 dot is the largest opening, so equal the least resistant. So it's easiest for the patient. The middle one is 2 dot. So it's between the least and the most resistant. The third one is a 3 dot. Is the smallest opening. That means the most resistant, the most difficult for the patient breathe. Each off and on is connect the power line. So I connect the wall plate and the tank. Okay, so the oral field devices is for the treatment. The first one, we go to the CPAP, and we can adjust the slow or fast for the lung expansion. After this cycle, we can go to the CHFO mode and start from lower and higher. So this HFSO mode for the secretion mobilization. So this is a treatment for about 2 to 5 minutes, as long as patient the tolerance. Then we circle back, go to the CPAP. And during the couple of circles, we can turn off the devices. So lung expansion mode for the several circles. So make a patient the lung expansion and the secretion clearance. So this is whole procedure of treatment used at Metaneb. Thank you.
Okay, so before you use your Metaneb, you want to do a pre-check. You want to turn your Metaneb on. You're going to make sure you're on the 3 dots, and then occlude the handset. When you're on CHFO, you want to put it on higher, and the pressure gauge, this one isn't working properly, but it should read between 15 to 30 cm H2O. And then once you make sure those are between those numbers, you can switch over to CPAP and put it all the way to high, which is counterclockwise. And this number should read between 20 and 30, not more than 30, not less than 20. And then your machine is ready to go.
So the patient should be in the semi-Fowler position while inhaling normally and exhaling slowly, usually 3 to 4 seconds. Adjust the ring to the 2 dot setting for higher resistance or 3 dot setting for highest resistance, whichever is more comfortable for the patient. Continue CPAP mode for approximately 2.5 minutes, adjusting the flow to achieve a therapy that is comfortable yet challenging for the patient or as otherwise provided in an institutional protocol. Instruct the patient that the mode will now change to the CHFO. Proceed with changing the mode to CHFO. So move the higher/lower switch to higher. During the treatment, the selector ring may be adjusted and the higher/lower switch may be moved to lower. The lower setting on the higher/lower switch reduces the percussion rate and the pressure. The switch may be returned to the higher position for enhanced therapy. Encourage the patient to inhale normally and exhale slowly, 3 to 4 seconds, against pulsations, keeping his or her cheeks firm to avoid pressure loss. Continue CHFO mode for approximately 2.5 minutes, alternating between CPAP and CHFO for 10 minutes, or depending on the patient need or as otherwise provided in institutional protocol.